Right, so here's the things with bugs, germs and infections. And when it comes to warfare, especially a war where medical aid and medical equipment are blocked from being accessed, you end up creating the ideal breeding ground for them, don't you? So it has been the case with Gaza, with various stories of serious infections breaking out and the stupefying news that polio had now returned to the Strip after it was eliminated at the end of the last century. All of that can be directly attributed to Israel's actions there, and their refusal to allow aid in violation of human rights laws, international humanitarian laws, the rules of engagement, all culminating in the blue and white state being dragged before the ICJ, and of course those arrest warrants now levied against Benjamin Netanyahu and the former Defence Minister Yoav Gallant. Israeli troops have not escaped illness fighting in Gaza as a result of that either, though. Yet still, medical aid was blocked, hospitals were intentionally targeted, especially as part of the so-called General's Plan in northern Gaza. Yet none of this has prompted a change in Israeli tactics where it comes to medicine. So should we be surprised that their actions have now created a so-called superbug so resistant to antibiotics that it is driving infection rates and fatalities, that is now defying science, and how big a risk to the rest of the world as a result of that is this continued genocide being allowed to persist further going to end up being? Right, so Israel having Gaza created the ideal conditions for superbugs to emerge, so resistant to all forms of treatment, doctors don't know what to do. They're seeing things they've never seen happen before, but actually should we be surprised when they have turned Gaza not only into a scene of ethnic cleansing, death and destruction, but having done so, created the perfect breeding ground for germs, bugs, bacteria, when none of the necessities to treat such infection and injury are being allowed in. Israel have created this monster that has now emerged, and given that bacteria does not respect borders, how long before it spreads? We all know all too well how illnesses spread when there is no way of effectively treating them. We've all lived through the pandemic, and pre-vaccine, the death toll worldwide was terrifying. There was nothing we could do except watch it roll around the world towards us until we learnt how to fight it. And right now, we don't have a way of fighting effectively what is emerging in Gaza due to Israel's stupidity and determination to abuse international humanitarian law and court orders laid down to it. Israelis getting ill from fighting in Gaza, stories of that are actually nothing new. They go largely underreported unless something exceptional happens, and even then it never gets widely picked up on. But it is relevant as to how long some of these stories have been going on for, as to how big a problem this has been. Last December, for example, let's go back almost an entire year now, there was a story about an Israeli soldier who had died because the infection he had contracted in Gaza was untreatable, a fungal infection. It was weird. And the Times of Israel picked up on this. The death of a badly wounded IDF soldier in an Israeli hospital who was infected with a dangerous strain of fungus while fighting in the Gaza Strip has raised concerns about disease in Gaza affecting troops and possibly spreading to Israeli civilians. According to a Cannes public broadcaster report, the soldier was brought to Asuta Ashdod Medical Center 2 weeks ago with severe limb injuries. Despite round-the-clock care, the fungus proved to be treatment-resistant and the soldier succumbed to his wounds. Military medical officials have not yet determined his cause of death, but confirm that there are isolated cases of similar fungal infections among wounded soldiers returning from Gaza. A year ago, and Israel knew it was picking up strange illnesses capable of killing that were treatment-resistant. All Israeli hospitals having reported wounded soldiers coming back with infections that were picked up through contaminated soil disturbed through fighting and the bombing, possibly in relation to abuses from the past in Gaza, possibly breathed in or getting into wounds. As pro-Israel as the Times of Israel is, their coverage of this incident did include warnings of what could come if such diseases ended up becoming communicable, able to be spread in the community. An epidemiologist called Professor Nadav Davidovich, who heads the Ben Gurion University at the Negev School of Public Health, made the same point I did earlier. The bacteria don't recognize borders, and it is just a matter of time before diseases springing up in Gaza, infecting Gazans, begin to infect Israelis too, who then bring it back into Israel, and so the spread increases. Now you can imagine what Israeli figures might say about all of this, can't you? The germs are Hamas. This is biological warfare even, perhaps, by Hamas. Because they have labs in tunnels, I suppose, now, don't they? I'm surprised, given the issuing of the arrest warrants by the ICC, they haven't declared Hamas bases underneath the Hague yet, because this is what always happens, isn't it? But the outbreak of polio, if we come back to that incident, shows it really is the genocide in Gaza that is driving illness there, and that falls on Israel. The World Health Organization declared a plan to eradicate polio from existence all the way back in 1988. It was just 11 years after that, in 1999, that Gaza was able to declare itself polio-free, and it had remained so ever since until Israel invaded following October 7th last year. Polio has ended up being found in the wastewater, and given that Israel has destroyed so much water and sanitation infrastructure throughout Gaza, just like everything else, it should come as little surprise that it is now spreading again. The conditions created to allow that, spread via ingestion of fecal matter, and less commonly, but certainly the more likely explanation in Gaza, through contaminated water. No clean water to drink, no aid getting in, so it spreads, and Israelis vaccinating themselves whilst holding up the vaccine into Gaza as they did, was a conscious choice to let the disease do their work for them, crippling the young as polio does. And so now we come to probably what was the inevitable end result to all of this inaction on disease up until now. Something mutated, something changed, something, given the opportunity, which it absolutely has been given, has developed into something resistant to typical treatment. And of course, typical treatment isn't even available in Gaza these days in itself, with medical aid blocked as it still is. And now we have something with the potential to threaten us all if it gets out and spreads widely enough. So this new superbug, what is it and where is it showing up then? Well, it may not even just be one bug. It's just that with antibiotics at a premium, people are not able to take full courses even if they can access them, expensive as they are in Gaza right now, as you can imagine, especially. And we all know the warnings about not taking the full course of an antibiotic by now, surely. And that is that the bugs will build up resistance to them if you do not finish the course. Essentially, this appears to be what has happened. Insufficient antibiotics are not treating conditions. They are helping the bacteria develop resistance instead. Now you might be sat there thinking, well, this is their problem in their part of the world, Damo. This doesn't affect me. We have antibiotics here. I can finish a full course. Perhaps ones Gaza doesn't have. But here's the rub. Not really, we don't. Every single antibiotic currently in circulation around the world has been in existence since at least the 1980s. No new ones have been researched until very recently. The emergence of superbugs in the West, like MRSA and the like, more and more bugs building up more resistances to those antibiotics we've always relied on for too many years, has meant there is a pressing need to develop new ones. But it is only now the science is getting done to do that. And although there are promising signs, that isn't the same as a doctor being able to prescribe something brand new yet. A lot of research has to go into antibiotic development, and they then have to be sold very cheaply globally to be of any benefit to us all. Therefore, Big Pharma for decades hasn't wanted to know about them. There's not enough money in it. So should these bugs in Gaza spread, it becomes a massive issue, especially if they do become communicable illnesses. At the moment, they are infecting wounds, but they're doing that to a staggering degree. Here's a short excerpt from The Cradle, one of very few media outlets covering this story, which is in itself shocking. As Israeli forces continue their attacks on hospitals in Gaza, doctors and medical teams in the Strip have been working under intense pressure and with great difficulty to treat illnesses and injuries due to the lack of proper medication and the rapid spread of bacteria. The medical teams in Gaza are fighting a fierce battle against bacteria which no longer respond to most antibiotics, said Izzadin Shaheen, a doctor in the besieged enclave, via X on 21st of November. Hardly any person with a wound infection survives, no matter how hard the doctors try. All the conditions are bad, no sterilisation and no sufficient antibiotics. We have even found E. coli bacteria in bone tissue, which is unfamiliar in medical books, Shaheen added. E. coli in your bones, that's food poisoning, in your bones. How? What is happening? Untreatable, life-threatening infections in wounds filled with maggots has also been described, as has the extreme lengths medics are going to try and find something to clean these wounds that work, something to kill the bacteria. They're literally pouring vinegar into wounds now to try and stem infection. That's how desperate things have got. And where antibiotics used to treat said germs previously, resistance now means too many are having to have amputations to treat an infection instead, or they simply don't survive. One example of a common illness that is currently out of control is impetigo. If you're a parent, your kid may have picked this up at some point, blisters on the face, bit of antibiotic cream clears it up a treat. Not in Gaza. According to the Bureau of Investigative Journalism, impetigo has become an illness so severe there now that cases of it covering entire kids' bodies. Part of the reason for this is that where Staphylococcus aureus is the bacteria typically responsible for impetigo, it is also the bug behind the MRSA hospital superbug that is resistant to antibiotics. MRSA is a variant of that, and it now 70% of occurrences of Staphylococcus aureus in Gaza are MRSA, drug resistant. Drug resistance of bacteria in Gaza was an issue before October 7th of last year thanks to Israeli occupation. Now it is so much worse. Previously, ongoing resistances and levels of it in bacteria found in patients could be tracked through the labs at Al-Alda and Nasser hospitals, but these have been bombed to smithereens and that facility is now gone. It can no longer be done. This is far from the only bug where increasing resistance is found, though. The full Bureau of Investigation journalism article titled "Gaza Bombardment Worsens Superbug Outbreaks" is well worth the read. It covers several other illnesses and bugs as well and the effects they're having, but be warned of some graphic photographs if you look that up. The question now, though, is how much longer will the world allow Israel to continue when drug-resistant illnesses are breeding like wildfire in Gaza, and it is only a matter of time before they spread further? Bacteria doesn't respect borders. I covered the polio outbreak in Gaza back in July. The warnings were there then of the danger disease presented not just to Gaza, but the rest of the world too, with its sudden reappearance, and absolutely tied to the genocide Israel are carrying out there. This is a situation that can and will worsen if something meaningful doesn't finally get done. And I can't help but feel this is in large part why hardly anyone is reporting on this, because there's a lot of blame to dish out. Get the details of that story in this video recommendation here as your suggested next watch, and I'll hopefully catch you on the next vid. Cheers, folks.